So welcome everyone. Thank you for attending our first virtual graduate and professional expo. My name is Julia. I'm the community-based research assistant in Careerspace at Trent University. So Careerspace provides an authentic outlook on the career landscape by providing Trent students and alumni with meaningful experiences, necessary perspectives, and valuable resources. We offer virtual appointments, workshops, online resources, and opportunities to connect with employers and recruiters. These services are free for all Trent students and alumni. You can visit our website, trentu.ca/careerspace, to book an appointment or learn more about our services. Just have a few housekeeping items, and then I will pass it on to you guys, the Brock University Faculty of Health Sciences. So I will ask all of you to put in the chat your contact information so that everybody has it. Something I've been finding is that you do have to actually click all panelists and attendees, otherwise it just goes to panelists, which is us, and I think we all already have each other's. So
okay.
Beyond that, we should have about 10 to 15 minutes for questions and discussion following the presentation today. Please feel free, students, to ask your questions at any time using the Q&A function located at the bottom of your screen. As well, today's presentation will be posted on our Careerspace YouTube channel. Without further ado, I'd like to welcome our guests from Brock University Faculty of Health Sciences and ask that you introduce yourselves. The floor is now yours.
My name is Dr. Isabella Ludva, and I am the program coordinator for the Masters of Public Health program. So I help administer the Masters of Public Health program, as well as our concurrent MBA and MPH program.
Next, I'm Tracy Shank, and I am the program coordinator for the new Masters of Applied Gerontology program at Brock. So it's nice to see and meet you all.
Hi everyone, I am the interim coordinator for the Master of Professional Kinesiology, and I'm working on putting our contact information.
Okay, so I guess I'm going to try sharing my screen so we can go through a couple of slides. It's just a really quick, brief overview of some of our programs and what the differences are, and like to leave as much time as possible for you guys to ask any questions and for us just to discuss the admissions process and anything about the programs. All right, so we're going to go through the various programs that we have in our Faculty of Applied Health Sciences. We have two types of programs. So we have research-based programs where you conduct research and you write a thesis. There are two types. So you have a Master's of Arts in Applied Health Sciences and a Master's of Science in Applied Health Sciences. And under each of those headings, you can see that there are different fields of specialization. So under the Master's of Arts, you can do a field of specialization in community health, in health and physical education, nursing, recreation and leisure studies, as well as sports management. And below the Masters of Science, you can complete a health sciences field of specialization or kinesiology. So depending on who your primary supervisor will be, who you will be working with, that usually helps designate which field of specialization you will be, as well as the type of research that you might be conducting. The research-based programs are two-year full-time programs. On the other side, we have our course-based programs. And with those course-based programs, we do have a practicum as well that needs to be completed. So we have four different types of programs. We have the Masters of Professional Kinesiology, the Masters of Applied Gerontology, as well as the Masters of Public Health. And we have the concurrent program, which is a combination of an MBA and an MPH degree. So you complete 2 degrees in 2 years. All of these programs require that you complete a practicum. The Masters of Professional of Kinesiology, Applied Gerontology, and Public Health are also 1-year programs, as well as the concurrent degree program, which is 2. So if we quickly kind of look at comparing all the programs, you can see that the research-based programs are 2 years full-time. You either have the Masters of Applied Health or the Masters of Science with the different fields of specialization. These programs accept up to 60 students, and part of your application process will include a statement of intent, and you will need to provide 2 academic references. These are funded programs, so as part of your acceptance, you will get a funding package, and this includes a graduate student assistantship and a fellowship. as well as part of your application will require that you need to identify a supervisor. So if you're not sure what the different types of research that are being conducted at Brock University, or you're familiar with who you would like to work with, if you go to the Faculty of Applied Health Sciences website, which we'll provide a link for, you can look through various faculty profiles, people who might be taking on students, and you'll also see which field of specialization conducting research with them will fall under. The Masters of Professional Kinesiology and Masters of Applied Gerontology are also one-year full-time programs, course-based. They take up to 20 students. The Masters of Public Health can be done full-time or part-time. The Masters of Public Health is our only program that is actually exclusively done online, regardless of whether we're in COVID situation. And we take up to 40 students. For all three of these programs, you need 2 references as well. So one academic, one professional. You can submit either a CV or a resume. And we also want you to include a statement of intent. These course-based programs aren't funded programs. So there are entrance scholarships that are available, and they are OSAP eligible. Because they're course-based programs and you're not conducting any research, you do not need to identify a supervisor as part of your admissions. But because they have practicums, you will have a practicum supervisor that will be out in the community that will be your practicum supervisor. The Concurrent Program is a 2-year program where you do MBA courses and MPH courses. You will graduate with an MBA and an MPH degree. There's 2 types of delivery. So you can opt for a hybrid delivery. So you can do your first year face-to-face where you complete MBA courses, followed by an online MPH, or you can complete the whole degree completely online. So there's 2 ways of completing the program. As well, the MBA has an option of completing a co-op, so 1 work term in the spring term as well. So you have the option of doing a co-op as well as the required practicum that is needed. This program accepts about 20 to 25 students. This one requires 3 academic references, 3 references, a mixture of academic or professional references, the same as a CV or a resume, as well as a statement intent. If you're not sure if you're eligible for the program, please send me an email, because for the MBA, MPH, there is an option to do a free pre-assessment as well. So all of our applications for the Faculty of Applied Health Science, the applications are always due by February 15th. It's a 2-step process. So you apply through OUAC, and in that part of the application, you have to provide a payment, give some background academic information, as well as any kind of volunteer or work experience that you may have. And you will provide your reference contact information, because those reference reports will be emailed to your referees and they will fill that out electronically. That will be followed up by an email that will give you access to an applications portal at Brock University, and there you'll upload your supplementary documentation. So either your CV or resume, statement of intent, and any transcripts that you may have. And I've just provided our contact information for all of the different programs, and we're happy to answer any questions that you may have. I know that was really fast and a really kind of brief overview, and there's some more slides that we can go through or bring up if anyone has any specific questions that we can answer.
Thank you so much for that wonderful presentation. I will just remind everybody, all the students, please do click on the Q&A tab and enter your questions. From June, hi, I am wondering that do you have any preference in undergraduate major? So June is interested in a thesis course in a Master of Science for Health Science.
I think it will depend on which course-based program you want. So here's kind of the MA, MSc. So if you want to look through the admission requirements here, we look at the last 2 years of study. So your average for your courses in year 3 and year 4, and that's for all of the graduate programs. But if you're looking for a research-based program, one of the things that they will look for is whether or not you've taken any data analysis or research methods course, whether it's quantitative or qualitative. So that's probably the one course, if you're looking for a research-based master's program, that you will want to have in your transcript. and if you're looking for the Masters of Applied Gerontology, there aren't any specific courses. Tracy, is there anything else that you would like to add in terms of courses or background that's important?
I think just as long as it has a health-related background of some sort, so nursing, social work, even psychology we would look at, but we would likely not consider an application with a general arts. So it has to have some connection to health and health-related study in your undergrad.
And then for the Masters of Professional Kinesiology, I know that they look at specific courses.
Yeah, thank you for pulling up the slide. As you can see on the slide, we're looking for a 4-year bachelor's degree in kinesiology or the equivalent. And the students have to show completed coursework in these courses listed in the second one. So human biomechanics, human psychomotor learning, assessment and exercise prescription, ergonomics, and exercise physiology. We look at the overall average for the admission average, but then we also look to make sure that the students have a strong background in these courses, because the great thing about our master's program is you're taking the knowledge that you learned in your undergrad and really cementing it with hands-on experience. So we want to make sure that the students have a strong enough background to be able to step right in and have that knowledge to be able to build on it.
I just also wanted to add that if you're looking to write the exam to become a registered kinesiologist, these courses are really, really, really important. And that's why they're included as part of the admission requirements when you apply. For the Masters of Public Health, it's not required, though we do strongly recommend courses in epidemiology and biostatistics, because those are core competencies in public health. And those are kind of at the master's level, they're a little bit, we're asking you to have some of that, apply that background knowledge. So if you haven't had those courses and you have a chance to take them before you apply, I would definitely consider that. If you don't, that is okay, because we do offer some kind of prereq courses before you begin the MPH. So you are able to take those before you apply, or they might be offered as a condition of your requirement to complete those courses. And if you're looking at the concurrent program, the admission requirements are a combination of the MBA and MPH. So your background in terms of your undergraduate degree doesn't necessarily matter because it's quite broad. We look at the last 2 years of study. Again, we recommend the epidemiology and biostatistics because that's required for the MPH component of the degree. But as part of the MBA, a GMAT or a GRE is required. However, if your overall undergraduate average, so your cumulative undergraduate average is 80% or higher, that test, the GMAT or the GRE, can be waived. That's not automatically assessed when you apply. It needs to be requested as part of your application. So I'm just gonna kind of go back up here and see if anyone else has any other questions. And I'm happy to skip through back to any slides as well, so it helps answer questions.
That's great. Thank you so much. While we kind of wait and see if any students have any questions, I have one. Do most students live near campus, and what is it like to live in this area as a graduate student?
That's a really good question. Allison or Tracy, did you guys want to answer that?
Niagara is great. There's lots of fun things to do in Niagara. We have beautiful hiking trails. I'm going to bias you all and say we have wonderful fruit. My husband grows fruit for a living, so lots of fresh fruit. And culturally, I think Niagara is becoming more and more enriched with Brock. Brock has brought a lot of, we have a beautiful performing arts center downtown, fun nightlife downtown, fun campus life when we're not in COVID. These other ladies on the phone are much younger than me. I'm older, so I don't probably do the same things as 20-year-olds, but Izzy or Allison?
Yeah, I'm well beyond a 20-year-old, so I'm not doing so much of the same stuff, but we definitely have some high class restaurants. Yes. Lots of great restaurants, lots of great different cuisine starting up here in Niagara. Like Tracy said, the fruit is to die for. Like, we're just getting out of peach season and getting into apple season, so it's a delicious time of year. We're also really close to lots of other great centers. So, for example, you could go easily to Toronto or Hamilton. When the borders open, then there's lots of great things to do just on the other side of the border in Buffalo, and that's like a 10-minute drive. So lots of things to do in this area.
I was going to say, I did my undergraduate. I grew up in Toronto, so I didn't move to Brock, or didn't come to Brock till I did my graduate degree. I did my Master's of Science in Applied Health Sciences and my PhD through the faculty. So I, like you guys, are considering coming to graduate studies after undergrad. So I moved to St. Catharines from the big city, and I really like the open spaces and the outdoors. I ride my bike everywhere. There's the nightlife was good as a graduate student, and the restaurants are great. So there's a lot of opportunities, and it was quick enough for me to go back home to go visit my family who lived in Toronto. So I found it was kind of the best of both worlds. And growing up in Toronto, I was always taking the subway and the bus. So being able to get around the city in a smaller, kind of slower pace was actually kind of nice also.
And your tuition includes a bus pass, and Niagara transportation is very, very good for students. And there's lots of student housing very close to campus, I can say, because I have a son who goes, and very, very, easily accessible from when you move off campus. It's great.
Yeah, and I just wanted to add, like, we have a lot of programs within the Faculty of Applied Health Sciences, but a lot of our courses and our programs are really integrated. So you might be doing a Master's of Science, but you're next to the lab that's doing work that's, more Masters of Arts, and you get to meet a lot of other students. Part of the research-based program is you have a seminar course with everybody in different fields of specialization. So it's really about how health is all really integrated. So you get a really interdisciplinary look at applied health sciences, even though you're within your own program as well, which I think it really is helpful when you're thinking about, maybe you want to go on to be physiotherapy or occupational therapy or dentistry or medical studies. Having the specific master's degree is great, but you're also exposed to other areas within healthcare, which is great.
So much. We have a couple other questions that were submitted. Do students have the opportunity to work with faculty?
You can go ahead, Allison.
Jules, I'm just reading that this question is from Jules. So it depends on the program that you're interested in and how much work you do with them. So if you're interested in the Master of Arts and Science, then you're working very hands-on with the faculty. So you would be running like your actual thesis with them. And there are lots of opportunities to publish from the work that you do within that. So for example, I just finished my Master of Arts in Community Health. And so I had my supervisor, but then I also volunteered with another lab, and I have numerous publications out of that lab. And within that program, then you do have opportunities to work as a teaching assistant. For the other programs, as Izzy had that slide up, and it shows how small our programs are with only 25 to 50 or 20 to 50 students accepted into each of the programs. You do get a lot of time to get to know the professors. With the course-based, you're not working as much hands-on with them, but you do still get a lot of time working with them.
I was going to say, for the Masters of Public Health, we have the practicum course, but we also have an independent study project course. So you do have the opportunity to do a little bit more work with a specific faculty member if they have the room to take on an additional student. So right now we have a student who's doing something related to e-health. And this is they're not one of our faculty members. They actually instruct one of our e-health courses, but they have their own business where they do a lot of e-health around the world and developing IT systems in different countries. And so this student was able to do an independent project with one of our instructors.
Thank you. And then we just have a couple minutes left, and then we'll have to wrap up, but we do have one more question. I was also wondering about opportunities to TA or even publish.
So if you apply for the Masters of Arts or Masters of Science program, part of your funding is that you are automatically guaranteed a teaching assistant position. That is part of that. So that's part of your funding package. For the course-based programs, it's not automatic, but you are able to apply to be a teaching assistant. So a lot of undergraduate programs are always looking for marker graders or teaching assistant over and beyond the number of students that we take for the MA and MSc programs. And so I always encourage my students to apply if that's the type of experience that they would like. As well, through the Center of Pedagogical Innovation at Brock University, they have special courses for teaching assistants. And so you can actually start to begin to build a teaching portfolio, so that if you're looking to go on to do your PhD, or maybe you want to go on and be a health educator in some way, having that teaching portfolio is really good. And you will see that if you're applying for certain jobs, if you have that, it's actually an asset.
And I'll just add to that, we also have a great Center for Pedagogical Innovation, where even if you don't get a TA position, you can take extra courses with them that will help to build your teaching portfolio, to be able to say that you understand how to teach different populations. Even to the switch to online teaching is obviously totally different, something that everyone is now dealing with that we haven't before.
And I'm just not sure, is this a new question then? Or did you answer that one, Allison, with your private chat? I can't tell. So I'm just not sure, are you asking specifically about one of the courses, or are you looking more for, because I see that you've worded it with health science, so I'm just not sure which program you are asking about.
Why don't June, I'm going to give you speaking access. Actually, I'm running a little bit low on time. I think what June is saying is, so I think our program is health sciences that would be like the most applicable, and June takes forensic science and was just wanting to make sure that that was like a related enough field.
I think so. I think for all of our programs that would be adequate. Yeah.
Yeah.
Okay. Thank you very much. And June, definitely feel free to email if you have additional questions about that. Okay. Yeah, thanks. Awesome. Okay, no problem. So I do have to run to another webinar. It's my last one of the day, which is very exciting. So thank you so much to all three of you for presenting, and to our students in attendance today for taking the time to learn about opportunities within the University Health Sciences. Thank you. So just a couple of announcements on the side of Careerspace. We invite you to attend our Trent-specific Graduate and Professional School Expo, which is held November 13th from 9 a.m. to 4:30 p.m. To register, you can visit trentu.ca/SEP and click on the November 13th hold the date. As well, Careerspace, in partnership with Academic Skills, is presenting a virtual personal statement workshop on Tuesday, November 10th from 1 to 2 p.m. Save the date. It will be posted on the Student Experience Portal's events calendar. You'll be able to register for the event from there. Most grad school applications require a personal statement or a letter of intent. With the knowledge you gain from this workshop, you will be able to create these documents and submit the best application that you can. So thank you so much to Brock University Health Sciences program for speaking today. Thank you for your wonderful presentation.
Thank you so much. And I'll just let everyone know,
Thanks for joining us.
I've put over in the chat all of our contact information and also our website links. So if people just want to grab that, copy and paste it into their clipboard before this chat ends. Thank you so much.
Thank you so much.
Thanks very much.
Bye.